Welcome to Heart, a podcast from the VCU Health Poly Heart Center, where we bring our experts in cardiovascular health and medicine to you to share their wisdom and expertise on all things heart health. Today's guest and expert is Michelle Gossip, a registered nurse and program manager at the Poly Heart Center. And before we begin, Michelle, will you tell me what exactly a cardiology program manager does?
Sure. So I have a small team, but we have a big responsibility. I am in charge of resources that provide care to patients who have chest pain, patients who suffer cardiac arrest.
That is one of the things that we're here to talk about today, specifically cardiac arrest and how to respond to it with CPR. So to begin, this is something I didn't know before I started working here. There is a difference between cardiac arrest and heart attack. I feel like a lot of people use those phrases interchangeably, but they're not the same thing. So can you explain what the difference is?
Sure. So a heart attack, let's start there. A heart attack is where you have a narrowing of a coronary artery or even an entire blockage. People often have chest pain-like symptoms. They could have that classic elephant on the chest. They could have arm pain, jaw pain. There's some symptom usually that lends you to think that something's wrong. It is an emergency, so I don't want to downplay the urgency of seeking care when you're experiencing those symptoms, but a cardiac arrest is where the heart stops. So obviously a higher level of emergency and requires immediate attention. Someone who has a cardiac arrest and their heart stops, they're clinically dead at that point. And without some life-saving measure, whether that be the use of an AED or the initiation of CPR, their chance of survival decreases within seconds of that cardiac arrest. So knowing CPR, knowing when to jump in to provide emergency care, and the steps of that are essential in that person's survival. The first step, in my opinion, is recognizing that someone is having an event like that. If somebody is having a heart attack, they're still able to talk to you. They're expressing their, symptoms to you. Again, still an emergency, and they need to seek immediate attention, call 911, and have that person evaluated in the emergency department. But somebody who suffers a cardiac arrest and their heart stops, they become unresponsive. They are blue or gray in color in their face. They may stop breathing, or they may have an unusual breathing pattern that maybe one breath every 7 to 10, 15 seconds, what seems like they may not take another breath. That is an immediate emergency. Activating whatever emergency system, usually 911 if you're in the community, is essential because you're going to step in and provide those CPR steps, but you want emergency services headed to you as quickly as possible. And then knowing the steps of CPR. If you are in the healthcare profession, you would have taken some type of certification class, and you will step into those steps immediately. But for the layperson who doesn't have any experience, maybe they have had a class, or maybe they have heard about CPR, maybe they've seen it on TV. They are scared in that situation. There is such a thing as hands-only CPR now in the community, and it takes the breathing component out of CPR, and we strongly encourage that hands-only CPR technique for the layperson who is got little experience with CPR.
Okay, so yeah, I think a lot of us have a conception of CPR as like what I would remember from like Honey, I Shrunk the Kids, where you do like mouth-to-mouth breathing.
Yes.
And all that. So you're saying that that isn't necessarily doesn't have to be a part of CPR today. Like, no. There's a simpler version of it that we can learn.
Correct. And you'll still learn that breathing compression ratio when you take a certification class. So I don't want to underplay the importance of using that. But in the lay public, for the person who may take a class and then it could be 5 or 10 years before they take another class, all the literature shows that even days to 30 days after taking a class, your knowledge decreases from what you learned. And so I would think that someone in the lay public would be afraid that they don't remember the chest compression to breathing ratio, or how to do the the head tilt chin lift method, or how to deliver those breaths. And then I think added to that is the last few years of all of the communicable diseases. There is a fear of putting your mouth on someone else's mouth, and so they might not provide or feel comfortable providing that type of emergent care. And so by finding the landmark in the center of the chest and providing that good depth of compression, you are going to buy that person some time until EMS can get there and get them to the hospital.
Okay, so just backtracking to where we started, cardiac arrest is in many ways like more sudden, like you wouldn't even know you were having one. You would just be out, you would
Often
be down.
there are no symptoms.
Okay, so it's immediate. And then if you are a bystander and you're not a healthcare practitioner, you're seeing someone collapsing, if you know CPR, then, or you feel comfortable giving CPR, then you increase the chances of survival from that event, which sounds incredibly deadly. I think I read somewhere that it's like 90% of people who experience cardiac arrest die. And so the chances of doing CPR improve those odds?
Yeah, probably 2 or 3 times the rate of those who don't have CPR.
Okay. And I definitely feel like you have trained me in CPR. You have. I have taken CPR classes in the past, like high school babysitting training, college, being an RA, whatever. And even today, I still am like, oh, I'm not sure I know what I'm doing. So I guess, you're going to show us how to do it. But what would you say to like the average person who's been trained in CPR but probably still feels hesitant? Like, if you see someone collapse, is it better to try, even though you might not?
Absolutely. Think about it this way. If you don't try, that person has 0 chance of survival. Even poorly done CPR is still better than no CPR at all. Again, following the steps first, activating whatever emergency services system you have, preferably 911, especially in the community, brings the emergency service workers to you quickly. Recognizing that someone is having that emergency and then starting CPR, it can increase their chances of survival by 2 to 3 times.
Okay, so first call 911 first. That's the first thing to do.
Absolutely.
And then start CPR. And then where does an AED fit into that? Actually, before you answer that question, what does CPR stand for and what does AED stand for?
Okay. So CPR is cardiopulmonary resuscitation, so heart-lung resuscitation. When you're doing CPR, you are imitating the workflow of the heart. By having a hard surface on the bottom of the person, typically the floor or board or something like that, and then you provide the compressions from the top, and when you push down on their chest, 1.5 to 2 inches, you're imitating the workload of the heart.
Literally squeezing the heart.
You're literally squeezing the heart.
And even if you're not giving the breaths, there's still oxygen in the blood that can be circulated.
Correct. Yeah.
For at least a little while.
Exactly.
Okay.
And then an AED is an automated external defibrillator, AED. And AEDs are found more in the community these days. Public buildings, grocery stores, libraries, schools. They are important if a person has a cardiac arrest in which a electrical disturbance caused their cardiac arrest. Sometimes a simple shock from an AED can restart that heart. And so AEDs have a vital role to play in the return of someone's heartbeat. In the event that you were to come upon somebody who needs CPR, you have to make some decisions, some real life in-time decisions. Do you know where the AED is? Can you get it quickly? Are there others around that you can become, like I always think about an orchestra. You become the conductor of the orchestra. I need you to get the AED. I'm going to start CPR, or I want you to start CPR and I'm going to get the AED because I know where it is. I always say if you're alone and require CPR, if you can get the AED quickly and get back to the person, and by quickly I mean 15 seconds tops, you know where it is, you know how to get it, you know how to activate it, and you come back, then I would take the time to get the AED, because that one shock may immediately bring them back. If I was not sure where the AED is, I was not comfortable with the AED, I would probably move forward with what I know, which is CPR, because EMS should be on their way.
And they have an AED.
And they have an AED.
There's one in every ambulance.
Every ambulance.
And so when you say AEDs are found in the community, do they all look alike? They're all that yellow box, or some are different than others?
No, they're not. They all have the same concept, but they may look a little different. You know, there are some that are in a yellow box. There are some that are in a red box. The real important thing about an AED, it's really kind of 3 steps. First, you open it up and turn it on. And usually that is denoted by a green button on the AED. So you turn it on. Then you follow the prompts from there. And the next step would be to place the pads. And on every AED pad, there's a picture of where the pad should go. Now, that could be a little unnerving in the middle of an event. So you would just take the pad, look at it, and then place it in the place that corresponds with it. And then the third thing is to follow the instructions. The AED is going to analyze what the rhythm is within the heart. And if it deems that the person has a rhythm that could be shocked, then it's going to tell you to stand back and press the orange or red button on the AED, which is the shock button. And then after it dispenses the shock if it's supposed to, or doesn't if it's not necessary, then it's going to tell you to resume CPR. And then the AED becomes a timer. And the AED will count down the next 2 minutes of CPR and tell you when the next cycle of analyzing and shocking is going to occur.
So it talks out loud.
It does.
To
It
you.
talks out loud.
So what I'm gathering from this, which I should have asked you from the outset, is anyone can also use an AED. It's
Absolutely.
not only for a medical professional.
No, absolutely. Anyone could use an AED. And I encourage people to use an AED. I encourage people to know where their AEDs are in their space. You know, as a healthcare provider, especially when I walk into someplace in scrubs, people look to you during an emergency. So I know where the AEDs are in my grocery stores, in the public buildings that I go to. I think that's just a part of my healthcare training, is that I want to know where everything is, because if I'm called upon, I want to be able to provide the best care I can. So an AED can be used by anybody. It is not a medical license, or a healthcare practitioner license is not necessary to use an AED, and I would encourage you to. One thing I will say though is AEDs are fallible. They sometimes, you know, breaks. The batteries could be non-functional. The pads could be missing. So again, I would take it back to what you know, which is CPR. So if you ever go to get an AED and it's not functioning properly, then you need to revert to CPR until EMS get there.
Okay, so takeaway number 2 is, my first takeaway is call 911 first.
Yeah.
Second one is make sure you know where your AEDs are in the paths of your life.
Absolutely,
Like,
your
I don't know.
workspace.
I don't know where the one is in my office.
See? We're going to
find
go
out.
do a field trip after this. Yes, absolutely. And also maybe you don't have an AED in your workspace. You know, for those that are listening from a community area, they don't have one. Then I encourage you to talk to your team members about getting an AED in your space.
Okay, so now we're actually going to show you what CPR looks like in action. So we're going to take a quick break and get set up, and we'll be right back. Okay, so we have talked about CPR, and now we're going to learn how to do CPR.
All right, let's
Michelle,
do it.
take it away.
Okay, so classically, remembering that somebody who suffered a cardiac arrest, it's sudden, and they are unconscious, not breathing, and unresponsive. So that's the first thing you're checking for, is unresponsiveness. So the first thing that you would do, a couple of things about CPR and when someone has a cardiac arrest, because of the sudden nature of it, they often fall quickly and don't catch themselves. So you may have to turn the person over on their back. I would try to keep their head as stable as possible, but getting them over on their back is the most important thing. Another thing about where you might want to stand when you're doing CPR, or where you might want to be when you're doing CPR, ideal position is on the side of a person. So you have your head, your chest, and your legs. You want to be on the side of the person. Unfortunately, in my experiences with cardiac arrest, it isn't ever elegant, and sometimes being able to get on the side of someone is just not possible, in which case you could straddle them a little bit, but really to the side's the best. So the first thing you want to do is check for responsiveness. So For anyone who has had a CPR class, Annie, are you okay? I know you've heard that before, but hey, are you okay? So I would give like a subtle little cheek slap, a good shake to the chest. This person is going to be lifeless, unresponsive, blue or gray in color. Remember, the person who is having a heart attack is going to be talking to you, telling you about their pain. Important and emergent, but this person is going to be unresponsive.
And you could conceivably like fall down in a restaurant because you fainted.
Sure,
not because you had cardiac arrest. So like a slap might wake you up.
Exactly. So when you go to check for responsiveness, oftentimes, like a good little slap or a little shoulder shrug will kind of have the person arouse. If the person begins to arouse, talk to you, or even mumble words, that would be a person that CPR would not be appropriate on.
Okay.
That's a great question. All right, so you are looking for your landmark at this point. Actually, you call 911, don't forget, that's your first thing. Check for responsiveness, you've identified the person's unconscious. The next step is calling 911. There also, let me say a couple things about that. So we all generally have a cell phone on us. So what I would do in that situation if I were alone is grab my cell phone, pull it out, put it on speakerphone, so that way I can talk to the 911 dispatcher as I am trying to perform CPR. If you're not alone, you don't have to be responsible for everything. If you're not alone, it's good to delegate responsibilities to other people. And my experience with people who are suffering cardiac arrest, others want to help, but they don't know what to do. So if you give them a responsibility, they feel invested and, oftentimes want to take on some level of responsibility. They don't often want to do CPR, but they want to call 911 or get the AED or any of those things.
I mean, that's honestly just good life advice.
Absolutely.
If you're not alone, delegate.
Absolutely.
You don't have to do it all.
You don't have to do it all. That's true. I have to remember that in my personal life.
Yeah, me too.
So the next thing is finding the landmark. Like, where do you want to have to do CPR? So, on my mannequin, it's this fleshy part between the breasts. But it's important before you have to do CPR to kind of think it out in your head. So on yourself, there's a flat bone that's right there between your breast. That is the pad that you want to perform CPR
This bone?
on. Yeah, a little lower. Right there.
Wow, okay.
Yeah.
Yeah.
That's the sternum.
Okay.
So remember when we were talking about what CPR does? The heart sits under the sternum. You use the hard bottom of the floor and the sternum to compress the heart. So this is what it looks like. When you're doing CPR, this is my technique, I'm right-handed. I encourage you to try this beforehand, so that way you can see what works for you. But I like to put my left hand on that sternal bone that's in the center of the chest. I lace my fingers over. You want to lock your arms out. You don't want your arms to be bent, because when you're doing compressions, then your arms give. You want your arms to be locked out. I would like to be able, when I describe it, I like to be able to fit a sheet of paper up under my hand, because what my goal is to compress the heart straight down. If my hand is on the chest, then I'm pressing this way, which is really not getting the most benefit to your compressions. So I have got my arms locked out, and I am providing 1.5 to 2 inches of depth on my compressions. Now, one thing that we haven't talked about, but I do want to make sure I reiterate, what we're showing you here today is for adults and teens of adult size. So I definitely want to make sure that I reiterate that, because for children and infants, it's a completely different scenario. So intended for adults and adolescents to teenagers. I strongly encourage, if you have children or adolescents in your care, that you really should seek a certification level CPR course, or at the very least, get a video and really understand the intricacies of children and infants when it comes to CPR.
Okay. That's really good to know. Thank you.
Absolutely. Okay, so let's just kind of run through it again. So recognizing that someone is having a cardiac arrest, so they're unresponsive, they're blue or gray in color, they're lifeless. You call 911. You either do it yourself or you appoint someone to call 911. So emergency services are on their way. That's the point at which you have to decide about the AED also. Either you can get it quickly and bring it back, or you can delegate somebody to go get that AED. What you don't want to do is wait till the AED comes back to start CPR. So if you send someone on to get the AED, you start CPR right away. Okay? So you find your landmarks, you look for that flat bone in between the breasts, you put your left hand down, cover it with your right, you lock your arms out, and then you start compressing. 1.5 to 2 inches. And at a rate of about 100 to 120 beats per minute. Now, there are a lot of songs that meet that requirement. One that I like to use when I'm teaching CPR is the song Staying Alive by the Bee Gees, but there's lots of others. If you have kids, Baby Shark is also a song that works. It would be really difficult to count that out. So what I encourage you to do is find that beat in your head and then just follow that beat the whole time.
Go along with it.
Yeah, go along with it. Now, what happens with CPR is you have about 1 minute to 2 minutes before you really start to get tired. I'd say you start getting tired at about 1 minute, but up until about 2 minutes. If you are alone, you're going to continue to do CPR until EMS arrive, until someone else comes who knows CPR, and then you could hand off to that person.
So if you are alone, there would be no breaks. You should not stop.
Do not stop.
Until medical professionals get there.
Correct. Continue to do CPR. Yes, you're going to get tired. One thing that you take into account is the level of adrenaline that you have under those circumstances. So you'll be able to do CPR longer than you think you can. Another thing that I do if I ever have to do CPR for a long period of time is I may start with my left hand as I've shown you, and then somewhere I'll start to say, gosh, in my head, my hands are getting tired, I'm getting tired, I'm gonna switch. So you might not even notice that it occurs. I switch hands. I cannot do CPR on this hand for that long, but it gives this other one a break, and I can take, a little break in that way, and then I'll switch back. But it would be like seconds. It would just be in the cycle of CPR.
And from what you said before, even if you don't have all of the technique that you described right, like you don't have a sheet of paper under your hand, or you're maybe going not deep enough, or not fast enough, it's still better to be doing something than nothing.
Absolutely. Even if your hand position isn't quite right, it's still better than doing nothing. Again, I cannot stress enough, doing nothing, this person has 0 chance of survival. 0 chance of survival. Even poorly done CPR or tired CPR is still better than no CPR at all. Again, this person has 0% chance of survival without it.
Yeah, I mean, I could see a lot of us getting like paralyzed in a moment like that, or just like, I don't want to touch this stranger. They probably don't want me to touch them, but I mean, if you're having cardiac arrest, you probably want someone to do CPR on you, even though you don't know that you want that.
Do it.
Do it.
Yeah, absolutely do it. There are some myths. I know that when I teach, this question comes up a lot. Do I need to pull the person's shirt up? Well, you don't. If you're not applying the AED, you don't. So you don't have to expose the person. But if you did, still do it. They need the CPR. You have to do it. Also, you're going to perform CPR to the best of your ability. Within the state of Virginia, you are covered under the Good Samaritan law to provide care based on your knowledge set. So again, to me, the travesty is doing nothing, because I know the person's not going to survive without it.
Okay, so can I try?
Yes, please.
So right-handed, so you say push with this.
I put my left hand down, I use the ball of my hand in the center of the chest, and I take my right hand, lace my fingers together, make sure your elbows are locked out, and then start your compressions. I have to lean up over the person because we're on this table to be able to get a good compression. 1.5 to 2 inches.
So it's going to click if I'm going down deep enough?
I
mean, is this
deeper.
What we're talking? This is hard.
It's okay. Faster and deeper. Deeper. There you go. And you don't want to bounce off of the chest, meaning you want your wrist hand to be in contact with the chest the whole time. Does that make sense?
Yeah. Okay, well, I don't feel like I did that very well, but I do feel like I know more than I did 5 minutes ago.
Okay,
so thank you.
Then I think that's a win.
Okay. Okay, so we finish our podcast with something we call lightning round. Not unusual in the world of podcasts, honestly. I'm just going to ask you a few fun, maybe a few more serious personal questions.
Okay.
So since we've been talking about CPR, and you're the expert and registered nurse, have you ever had to do CPR on someone not in the hospital, like out in the world?
Yes, I have. Twice in my medical career, I've had to do CPR.
And is it different outside of the hospital, or is it kind of the same for you?
Of course it's different outside of the hospital. You know, I think if you asked 10 healthcare professionals, you know, CPR in the hospital, you have your colleagues, you have your equipment, you're comfortable. CPR in the community is a completely different environment. Nervous, even though I have been certified in CPR for probably 40 years, 30 years. But in the environment of outside of the hospital, completely different world.
So it's okay to be nervous. It's normal to be nervous. Even
If you're not nervous, I'd be nervous for you.
Okay, fair enough.
Definitely nervous. And, you know, as we were talking about AEDs, one of the people that I provided CPR for, we did use an AED on, and they did come back from that AED shock. So I am living proof that the AED does work. And the other person, we just did CPR until EMS arrived.
Well, that's amazing.
Yeah.
I mean, yeah. I feel like you've probably saved so many lives besides just those two by teaching CPR, which is pretty incredible.
I'm pretty passionate about it.
What is your favorite way to get some exercise?
Walk. I love to walk. Walk the park, walk the streets of my neighborhood, with my neighbor, with my friends. It is definitely my way of burning off steam and stress, but I also just love to be outside. So walking is definitely my favorite way to get exercise.
I love that. I totally agree.
Yeah.
What's your guilty pleasure?
Oh, baked goods.
Do you like to bake? Or you like to just eat the baked goods?
I love to bake. I love to eat the baked too, but I love to bake. I love to cook, period. But baked goods are my guilty pleasure, especially chocolate covered donuts.
Oh.
Yeah.
Okay.
Guilty pleasure.
Love it. What is your favorite day of the week?
That was a hard one. Probably Friday, as I know that it's leading into time with my family. You know, Friday for me is a wrap up of work, so it clears my mind, and then I'm ready to spend time with my kids and my husband. So I would say Friday.
Okay, finish the sentence. I am a fan of blank. It could be anything. Sports team, musician.
Sports, period.
Just all sports?
I love sports, especially basketball, baseball, football. I'm a huge sports person. Love
What are
it.
your teams? Do you have specific teams?
Well, as we are headed into baseball season, I'm a Yankees fan.
Michelle, that is not acceptable.
So sorry.
I grew up in New York, and I just can't even with the Yankees
Let
fans.
me guess, you're a Mets fan.
No, I'm a Phillies fan, actually.
Okay. Yeah, I'm a Yankees fan. I am a lifelong Commanders fan, former Redskins, now Commanders fan. Mm-hmm. I swam competitively. I played sports in high school, so I love sports.
What do you wish more people knew about their health? Any aspect of health, not just heart health.
Gosh. Well, it's so funny, as we have been in February with Heart Health Month and all the things that are going with that. You know, for me, small changes have big impact. I think that awareness is key. You know, knowing your numbers, not to be cliche, but knowing your numbers, knowing what your blood pressure is, you know, having your cholesterol checked. Being a steward of your own health, making sure that you have your annual visits to the doctor. Don't ignore subtle changes in your health. Have those checked out. Don't explain them off. It could be something very important. It could be something, you know, not. But you don't know if you don't check. So I think that small changes in your health choices and, you know, knowing your numbers, I think that probably would be my top two.
I think that's great. I was thinking the other day, I was like, a good slogan for the whole hospital for all VCU Health would be, don't put off going to the doctor for so long that you have to come to us, where we care for the sickest and the most complex patients, right? Because so much of what we do at Poly is preventable.
Yes. I think if you don't put the work in to be healthy, you're going to end up putting your time in being sick.
I am going to remember that the next time I'm feeling too lazy to exercise, so thank you. Well, that's the whole lightning round, and I think that's about all we have time for today, but I so appreciate you taking time out of your schedule to teach us CPR and answer all of my really ignorant questions about cardiac arrest and AEDs and CPR and acronyms. So I really appreciate it, and thank you for listening and watching Heart to Heart, and we'll see you next time.